time to go by the table, pick up a lot of the information. Really tell the people that you serve, how valuable it is. And that it is a free program. That's the big thing. A lot of people think everything costs now. This is something that is free. If they have a cell phone, if they have texting capabilities on their phone, they can get it for free. So, as we go on, if you have any questions, definitely feel free to contact me or anybody at the table or Lindsay with any questions. I have cards on the table as well. But with that, I am going to turn it over to you. That's why you always got to stay on your toes. Turn it over to Miss Sarah.
Good morning. Good morning. I'd like to welcome you to our facility, and I hope that those of you who have time will get an opportunity for a tour. And before I go any further, I want to acknowledge our chair of our Board of Health, Ms. Sue McLaurin, who is just going to pop in and may have to pop out because she has another commitment. But this is a fabulous opportunity for us to celebrate North Carolina being third in the national state activity of enrolling people in Text for Babies. It was a friendly competition where we could see how many states would enroll the most people in Text for Babies. And we all know that technology is where it's at these days. And with the huge numbers of babies born underweight and low birth weight, I think it's like 500,000 across the nation, and the numbers dying before their birthdays, we need to pull out all stops in order to try to eliminate the deaths of these premature events. And so I'm very pleased to say that North Carolina took up the challenge and enrolled a significant number of women since May of 11 in this wonderful event. And those of you who haven't tried, I tried to do it, but I had to answer whether I was pregnant or had a child. And I didn't think that my 33-year-old quite met the expectations of a baby. So I didn't do that. But it's a wonderful opportunity for people to get reminders on a weekly basis of how to take care of themselves and their babies and to take preventive measures. And so we celebrate the success in North Carolina, and we know that Text for Baby is going to make an enormous difference in the way that our health outcomes register in years to come. So at this point, I want to turn the celebration over to Janice Friedman, who's the head of North Carolina Healthy Start, to talk more about it. So thank you for coming.
Well, thank you. This is so exciting. And I put some notes together only to keep me on track, but I could talk about this forever. But as one of the many Text for Baby partners in North Carolina, I'm just thrilled to be here and celebrating our success. For all of you that heard we came in third, which is great. We actually were in first place for most of the time and dropped out the last couple of days. But that's okay, because other states are doing some wonderful work too. Obviously the need has been described, why we want to get more information out to women. The statistics highlight the need for really innovative strategies that are relevant, that are accessible, and that are affordable. And Text for Baby provides all that. So it was a no-brainer that we wanted to hop on board and make sure that everyone in North Carolina heard about this. And from focus groups we've done in the state, women say we want information, we want to be linked with resources. So this is something that not just those of us in agency thinks is a good idea, but the community, the people that we really work to serve, really have appreciated it. I would have to definitely take time out to thank the Department of Health and Human Services, Division of Public Health, getting their new name soon, and the Women's Health Branch for taking leadership, because there are a lot of different efforts in North Carolina, but they really provided that leadership and held us all accountable and together. And I really want to thank the folks that are here today. Our agency, the North Carolina Healthy Start Foundation, has worked in a public-private partnership with the state for over 20 years to reduce infant mortality and improve the health of women and babies. And we've had a long-term relationship with Healthy Mothers, Healthy Babies. So it was just a natural that we wanted to come on board. So what did North Carolina do that was so successful? Well, first of all, we took that challenge very seriously. And we said, Tanya said, we need to get on this, and she's the boss, so we did. And because it's North Carolina, we always have to do different and more than what we're given. So Healthy Mothers, Healthy Babies provided amazing materials and resources, but we had to improve. So the first thing we did is the little point of purchase stands you can see over here. We developed those, English messaging on one side, Spanish on the other, and business cards that fit in the front. And we distributed hundreds of these around the state so that where people are, they can see this. Now, we haven't gotten them in every location, every community, but we're going to keep working on that. We're buying more, and we're going to ask you all to help us get those around. And those stands did win a national award from the National Health Information Group, honoring the nation's best consumer health materials and programs. So we're pleased that they recognize that they're an effective and attractive way to get information out. Those stands have also attracted the attention of Community Care of North Carolina. I've talked with one of the networks and someone at the state level to see about getting those in all the network providers' offices or those that want it, because with pregnancy medical at home, it's a natural and it's a great resource that they actually have asked about. So we were going to follow up on that. We tailored posters that National Healthy Mothers, Healthy Babies had developed, because in North Carolina we think we know what will work here a little bit better, and flyers that you can see out there, the business cards, and they're all available at no cost through the catalog of free materials on our website. And then in last April we ran over 500 radio ads produced by Healthy Mothers, Healthy Babies in 3 different media markets in the state. And you can see from their metrics the number of subscribers went up, so that was good. This is all before the challenge. Okay, so as Tanya asked us to partner with others and work collaboratively, it turns out that North Carolina got federal funding, the federal pregnancy assistance money, that allowed us to do some media and social media through one of the projects. And so we were able then to create, I would say, the country's first television ad, because we beat Healthy Mothers, Healthy Babies out the gate. Their ads are absolutely wonderful, but we were running ours first, and now there are 3 that the rest of the country can choose from. As it turns out, the 2 women that we selected to be in the ad were already subscribers and getting messages from Healthy Mothers, Healthy Babies. So when I asked them, they were absolutely. And I want to recognize Suzanne, who's here as one of the moms, her baby Zane, who was in the ad, and her husband Patrick, who has been an amazing supporter throughout this whole art. And you can see, yeah, he's flirting. So we ran the ads in 3 urban areas. We wanted to reach a lot of people. We're going to get them out rurally at some point, but that was really important. Triad, Charlotte, and the Triangle were the first areas. They ran all of last August with programming specific to women 18 or 18 to 34-year-olds, and we used the outlets that the women themselves have told us over and over again are the stations they're watching. So it was Time Warner Cable's, BET, MTV, Nickelodeon, Lifetime, the Learning Channel, and then in the Triangle we use CW 22 and RDC 28, which is a smaller network, but I really would recognize them because they produced our ad at no cost in one of their houses, and then ran the whole month of September at no cost to us. So this is where the partnership works. I don't think the state could have driven that kind of deal, but a nonprofit, it's a wonderful partnership. It works all the time. And we are going to be airing those ads again throughout this year and then into 2013, so watch those numbers go up. Of course, the radio, the TV, all the materials are on our website. We have a Young Moms Connect website that's been developed for, can always say this, I think, parent and pregnant teens and young women. So they can either see it through YouTube, they can see it on the site. Now the new link for people to sign up directly is at the top of our homepage on the North Carolina Healthy Start Foundation's website and on the Young Moms website. So you come to us and bam, it's right there in your face. You can click and sign up. And of course, it's on YouTube, and I cannot say that it's gone viral yet. But as of the other day, there were more than 1,000 viewers. Well, this is just one of how many things on YouTube. I think we should feel good about that. And we know that the ads really made a difference, plus what folks were doing out in communities, because we increased the number of subscribers in North Carolina by 90% during this time period, from the summer to October, and the numbers keep going up. So I think we should all pat ourselves on the back. And North Carolina was featured on Healthy Mothers, Healthy Babies webinar as one of 2 states to discuss their promotional strategies. So hopefully some of what we tried and learned is now, being implemented in other places. I've probably talked way too much, but you can tell I'm really excited. We've done a lot of things. We've been successful. We've got great partners. There is no stopping us now. So thanks to all of you, because it may originate in Raleigh, but it doesn't work if it's only in Raleigh. It's got to be out there throughout the state in as many ways as we can imagine it. So thank you, and let's keep on keeping on.
And so our next person is one of the primary sponsors of this, is Lindsay, who's gonna, I think she's got a few words from the national office.
Thanks, Tanya. Well, thank you all for being here. I'm really happy to be here on behalf of the National Healthy Mothers, Healthy Babies Coalition Text for Baby program. We are based in Alexandria, Virginia, and we work with states all over the United States. I'm one of the outreach coordinators, and one of my states is North Carolina. So I'm very excited that North Carolina did such a great job in the contest, and I've been working with Tanya Daniel, who has done a phenomenal job, not only working with the state on different Text for Baby promotional activities, but also planning this wonderful event to celebrate North Carolina success, 3rd place in the contest. So thank you, Tanya, for everything you've done and everything you're doing for Text for Baby in North Carolina. I'm going to read a letter on behalf of the campaign director of Text for Baby. She's really sorry she couldn't be here, but she's very excited for North Carolina and is happy that we're celebrating the event today. So let me read the letter on behalf of Sarah Ingersoll, our campaign director. Congratulations to North Carolina Text for Baby partners for winning 3rd place in the 2011 Text for Baby State Enrollment Contest. On behalf of the National Healthy Mothers, Healthy Babies Coalition, CTIA, the Wireless Foundation, and our founding sponsor, Johnson & Johnson, we thank you for all of your efforts and support. North Carolina Text for Baby partners have made a difference in the lives of thousands of mothers and their babies. You all have done a great job promoting Text for Baby through many activities, specifically Text for Baby public service announcements like Janice mentioned. We successfully gained statewide buy-in from diverse agencies and organizations to create a strong group of partners that have been active and serve as a model for states across the country. As a result of your significant efforts, there were large increases in Text for Baby enrollment in North Carolina when Text for Baby radio segments played in April and when Text for Baby PSAs aired on the TV stations in August. Each partner has contributed to this public-private partnership by bringing your passions for maternal and child health and your creative relationship-building skills. February is also Text for Baby's 2nd birthday. So we're excited to not only celebrate North Carolina's success today, but also Text for Baby's accomplishments over the past 2 years. Our enrollees let us into their lives 3 times a week and look to you as a credible source of information about their health and that of their child. Your organizations are part of a network that is over 700 strong, representing an unprecedented force. Since launching in February 2010, Text for Baby has sent out over 28 million messages. That translates into approximately 5.5 million messages that have been sent out on baby safety, 3 million messages that have been sent out on baby's nutrition, including breastfeeding, general nutrition, and WIC, 2.7 million messages that have been sent out on baby's development, and 2.4 million messages that have offered emotional and mental health support. You are making these powerful messages a reality. Pregnancy and motherhood bring a great deal of joy into a woman's life, but they also create new and unique responsibilities. Knowledge and peace of mind can be powerful tools to help expecting and new mothers meet their new demands, and Text for Baby provides them with valuable information during this time. Thanks to the commitments of partners like you, more than 250,000 people have access to critical health information available through Text for Baby. North Carolina's outreach efforts have helped advance and continue to contribute to the overall success of our national efforts to connect moms to care and support healthy babies. We look forward to continuing to work with North Carolina and to reaching 1 million moms in the United States with critical health information and safety information by the end of 2012. Thank you so much again to everybody here that's supporting North Carolina and to all the North Carolina Text for Baby partners. Sincerely, Sarah Ingleshall, Campaign Director of Text for Baby. I now want to call up North Carolina's new State Health Director. I was told this is her second day on the job. That's incredible. We are so happy that she's here with us today. Dr. Laura Darrow.
Thank you. Thank you. Thank you for inviting me here today. I'm glad to be here at your new facility. I will be going on that tour after this. I am Laura Gerald. I am the new State Health Director. I'm a pediatrician by training and mother of young children, so maybe I'll be able to text that thing, although I'm a little bit more removed from the baby stage, but I do appreciate both professionally and personally the importance of the Text for Baby campaign and know how helpful that can be to moms of young children in getting resource information. I am here to do more preaching to the choir and tell you more about the details of how North Carolina was able to obtain this third place award. And I'm also here representing the North Carolina Department of Health and Human Services, but we're proud to be one of many organizations promoting Text for Baby here in North Carolina. So what are the numbers? The contest enrollment period was between May 10th and October 20th, and the winners were announced at the American Public Health Association meeting in Washington on November 1st. During that contest period, 4,762 new users were enrolled in the Text for Baby service in North Carolina. As you have heard, that's a 90% increase. We went from 5,279 enrollees during that period to 10,041, and that is quite an accomplishment. That is, again, that allowed us to come in third place nationally by enrolling 4.4% of moms who were eligible. Since the launch of the program, over 11,000 mothers or parents have enrolled in the program here in North Carolina, in the Text for Baby program. And you've heard a lot about the partnerships that were needed in order to accomplish this. And in North Carolina, we're all about partnerships and collaborations. And so I want to take some time to specifically name the partners here in North Carolina. We want to thank the Alamance Partnership for Children, Blue Cross and Blue Shield of North Carolina, Cataract County Health Department, Columbus County Health Department, Durham Early Head Start, Granville Vance District Health Department, North Carolina Chapter of March of Dimes, the North Carolina Department of Health and Human Services, North Carolina Healthy Start Foundation, Onslow County Health Department, Park Ridge Health, Smart Start of New Hanover County, Wilkes County Health Department. And of course, we want to add to that partnership list over the coming months and years. Again, we want to thank each and every one of our partners for extraordinary efforts in promoting services. The 2011 enrollment contest is just the beginning of redoubled efforts to connect women with health information and resources that Text for Baby provides. And again, we hope that's just the beginning and that there will be many, many more mothers and parents of young children enrolled in the future. Thank you again for your efforts, and thank you for having me.
Mr. Arlen, do you want to have any special remarks, sir?
We would like to thank you for coming and participating in the celebration. We're glad to have you here at the Durham County Health Department. Anything you need during your stay, please let me know. We'll make it happen. Thank you.
Thank you, Dr. Aaron. One of the things we wanted to do was at least let people see the PSAs. So when they come across your TV screen, you'll know that, hey, I saw that before. And we have the North Carolina PSA. So Janice, do you want to introduce that one? Or
Do I need to put it in there or just talk?
Oh, no, we haven't
we
written
have
it.
it?
You can just introduce it.
So you may, it's kind of small, and of course we'll be able to play it over. But I apologize for that. We didn't have a big gigantic screen. But we can play it from here. And for those of you who want to, hopefully everybody will at one point in time.
Sure. Do you want to introduce it and then we can
We had a lot of fun making this. I want to recognize Kendra from CW22, who really helped put this all together with her producer and lent us her house. And again, Suzanne and Zane, who are in it, and Matilda, who's in Mexico today or would be here with us. They were naturals. We don't like to do talent. We don't like to have professionals. We want real people who others can relate to. So that's what we did. It was a wonderful day, and we're just thrilled that it can help. With Matilda being the second one we selected, we did adapt. This is an English-only ad right now, but we also said how you can access it in Espanol. So.
And so here we go.
You get a manual with the car, and you get a manual with the appliance, but you don't get one when you have a baby. Need help? Use Text for Baby. If you're pregnant or a new mom, you can get timely information to help keep you and your baby healthy. Just text BABY to 511-411. Through this free service, you will get health tips sent directly to your cell phone. Be good to yourself and your baby.
And like Janice mentioned, North Carolina actually developed their PSA before National Text for Baby thought of doing PSA. So they had that great idea, and we jumped on board and thought, oh, this is excellent. We should develop a few more PSAs. So North Carolina had this one, and like we mentioned, enrollment in Text for Baby in North Carolina increased a lot once they started showing the PSAs. So the next two PSAs we're going to show you are the ones that we mentioned that Text for Baby recently developed. One is called Belly to Belly, and you'll see it shows two pregnant women talking about their two friends, and they're talking about their pregnancy. One has already signed up for Text for Baby, and she encourages her friend to sign up as well. You'll really like that one. And the next PSA is called Baby Photos, and it shows different photos of Text for Baby babies from different moms that have enrolled in Text for Baby, and talks about, again, the process of signing up and the benefits of Text for Baby. Before I show the PSAs, I really want to encourage you all that, partners in North Carolina or anyone who works with TV stations or knows TV stations in the area, to really encourage them to show the PSAs. It is a really effective way to get the word out about Text for Baby. Like we've all been mentioning today, it's such an important service that we want to spread around North Carolina to pregnant moms and new moms until their baby's first birthday. So again, we encourage you to get the word out to TV stations, play these PSAs. We're very excited about these PSAs as well as the North Carolina one. So I'm going to first show you the Belly to Belly PSA. Make sure the volume is all the way up.
We have a question.
Sure.
Yes, I need free text to mom.
Yes, yep, the service is completely free. When moms sign up, they get 3 text messages a week. Yeah, and we encourage you, there's information also here at the table on how to sign up for the program. If you want to take information and give out to people at the health department or at your organization, we'd love for you to take it. Request more materials on our website as well. Thank you. So this is the Belly to Belly PSA. Oh, actually, this is the Belly to Belly.
And just as an aside, if somebody signs up today, they get their name put in for a drawing of one of these baskets. So they got to sign up, physically sign up using their cell phones, not. They have to physically sign up while they're here today.
All right, so here's the Belly to Belly PSA.
Baby, are you meet? Baby Maya. Oh, it's for us. Your baby's getting text messages? Yeah, I signed us up for Text for Baby. We get free text messages every week. Look, car seat for the hospital. That's a great reminder. How do we sign up? Text BABY to 511-411 and you'll get free health and safety tips every week. Okay, we're signed up. Look! That's one smart baby, just like her mom.
And then, like I said, I'm going to show you the next one, Baby Pics.
All of these babies are part of the same thing. Text for Baby. Text for Baby is a free service
YouTube Text for Baby, you'll see both of these PSAs. So you can put them on your websites, talk about them on Facebook or Twitter. So again, thank you for watching the PSAs, and
Renee is working hard, previously. Well, that is actually the end. Feel free to look at the table and take whatever information that you have over here. For those of you who are special guests and partners, we'll have a reception on the 3rd floor. You can go on the elevators to the 3rd floor, and somebody will be there to kind of help you get to the reception. But I thank you so much for coming. And if you are not a partner, you're a part of an agency, please contact me. I got cards on the table because we can get you an MOU and we can get you on the bandwagon as well. And next time when they have a contest, we can do even better. I'm not going to say do the same thing, but we're going to do even better next time because I was really proud of North Carolina this time. But thank you so much for coming and enjoy the rest of your day.